The summer heat is here and the coast is calling, and now CityCast listeners can save 20% off weekday stays at SCP hotels, like the Salishan Coastal Lodge. Offering over 200 acres of breezy coastal playground, you and your family can book the perfect getaway that can include everything from golf, zip lines to spa treatments. Best yet, your pup is welcomed. Book your Oregon Coast adventure at salishan.com today with code CityCast. Today on CityCast Portland, we're talking through a few worrying headlines about the care and safety provided at Providence Health and Services and Legacy Health, two of the biggest Portland area hospital systems. From the possible accidental spread of life-changing infectious diseases to dangerous misdiagnoses and failing lab services, there's just a lot to cover. And joining me on this midweek roundup is our very own producer, Giulia Fiaoni. It's Wednesday, July 24th. I'm Claudia Meza, and this is what Portland's talking about. Welcome, everyone, to our midweek microdose of news. Giulia, thanks for joining me this morning.
Hey, good morning.
If you're new to the show, today is the day we look at a local story or updates to a story that we might have missed late last week or that happened over the weekend. Regular listeners might remember we started doing midweek roundups earlier this year, but then stopped because of our month of mayoral candidate interviews. And then we also paused because we had our city council candidate breakdowns via district. But we're back, baby. And now they're landing on Wednesday, the true midweek.
Yes. The better feeling not taping on Monday, Wednesday.
And they're happening every week now, right? I feel like I don't know what's going on ever. So
it's not every week yet. It's still every other week for a while. So stay tuned for updates on that front. But we are back with these roundups.
Every other week.
Every other week.
Well, this is going to be an interesting one because we have a couple of stories that are focused on two of the largest hospital branches in our area. Giulia, I think yours might be the most troubling one. Do you want to kick it off?
Yeah. So my reporting comes from Amy Green and Christine DeLeon from the Oregonian. And they're talking about how two Portland area hospital systems, like Claudia mentioned, Providence Health and Legacy Health, announced last week that roughly 2,400 of their patients may have been exposed to HIV or hepatitis by a doctor that, quote, breached infection control practices. So apparently this doctor was involved in around 2,400 different surgeries or other procedures for Providence and Legacy and was a member of the Oregon anesthesiologist group. So patients who are affected will be receiving notification letters, but in the meantime, statements from both hospitals have been made. And it's interesting because they varied in detail, with Providence offering the most information. But the Oregonian reported that 2,200 of those patients were from Providence Willamette Falls Medical Center in Oregon City. 221 were at Legacy Mount Hood Medical Center in Gresham. And only 2 patients were at Providence Portland Medical Center in Northeast Portland. So it's a little bit rough because from the statements, it was said that the doctor was treating patients from 2017 through May of 2023. So it's quite a long time that you could have come in contact with this provider. But right now, the good news is the state health officials said that no one has come forward with an infection related to the exposures yet, and that both Providence and Legacy said that this person that is believed to be responsible for this is no longer working for the Oregon anesthesiology group or treating patients in their facilities. But yeah, Claudia, what's your initial reaction to this?
Completely horrified. Like, that's the scariest stuff, that you can think of, is that you go for something routine or whatever, and then they're just like, oh, oops, you have cancer, and I did it. You know what I mean? Yeah. You're just like, what?
I mean, yeah.
Why?
That's the thing is like, one of the things that was released through this was a statement from the Oregon Health Authority acknowledging the stress of the matter. And they also added that 1 in 31 U.S. patients have healthcare-associated infections on any given day, which was not comforting. They were like, hey,
Well,
sorry about it, but also this happens often. So, and I'm like, what?
no, not like this. I think they're talking about staph infections, which is a very common gram-positive bacteria that happens at hospitals because people's immune systems are lower, and even though they're cleaning up, people do get infections, at hospitals because they're around illness. I just don't want it to be like, we're like, I don't know, fear-mongering. We're like, you're going to go to the hospital and you're going to come back with, you know what I mean? It's like,
no,
that's
I know. It's just funny to read the numbers. It's like, oh yeah, no, this happens. You just forget. You go to the doctors thinking like everything is accounted for, but they can only account for so much. Like things can only be so sterilized with how many people are coming in and out. So to see the numbers like that, it's always like, oh yeah, well, this is just how it is.
Yeah, it is really scary.
Yeah.
So while I was researching the story that I'm about to share, I came across another terrible story from back in February that Fox 12 reported on when they found nearly a dozen patients' lab results were incorrectly reviewed by a pathologist working at Providence, a Dr. Jeffrey Harder. This included a woman being told a biopsy was normal and then getting re-diagnosed as a high risk for cervical cancers, with the next steps being removal. And it was like months passed by before the correct diagnosis, which could have meant like full-blown cervical cancer. And that's why I kept thinking of cancer when you were saying this, because I was like, yeah, you can walk out with cancer because they don't catch it. To me, I'm like, yeah, it's so scary. Like either you get something accidentally from them, but also what's scary is that they don't catch it. Like they're just they're like, what? Oh, you have cancer. Oh, sorry.
Yeah, oops, sorry, I forgot to let you know.
Again, they were just like, this doctor no longer works here. Well, anyhow, so they're actually looking at a lawsuit from a few of these people who were misdiagnosed because it is cancer related. It's pathology, it's biopsies and stuff. And I can't imagine right now the world of just lawsuits that are going to happen at Providence.
Yeah. Yeah. And they're already struggling financially. It's been a bit of a mess, but before we get into our other headline related to both Legacy and Providence from last week, I did want to mention that for people who are notified of this potential exposure to HIV and hepatitis, they are encouraging patients to go and get blood tests done for free, and that they'll be in touch if something does come back positive. And that a spokesperson from the Oregon Anesthesiology Group said, quote, that even though the risk of infection was low, in this case, new protocols and procedures have been put in place to prevent similar incidents from happening in the future. So the alarm bells have been rung, and I guess we'll just have to wait and see if anything actually comes from it.
Yeah, well, that's really scary. It's a good thing that Providence and Legacy are giving away free lab tests, but the next story that I will share might add some more attention to that. Offer.
Yeah.
Well, let's take a quick break here, and when we return, some more news coming out of both Providence and Legacy. Making the right senior living choice is more than just a simple move for your parents. These are long-term care plans. You need solid information and the right person to walk you through each step of the decision-making process. And Lynn Smarges is that person. She's a trusted senior advisor and placement specialist that works tirelessly to ensure your loved ones find the best care tailored to their specific needs and preferences. From independent living and assisted living to memory care, Lynn guides you every step of the way, offering advice, valuable resources, and unwavering support. She researches the retirement communities which best fits your senior family members' circumstances. Not only that, she sets up the appointments to tour these communities and walks her families through each tour, advocating for them. You can rely on Lynn to offer your family the care and compassion you need during your senior living journey, because sometimes you just need that extra hand. You can also find out more about everything Lynn has to offer by tuning into her podcast, Caring for Your Aging Parents, on Spotify, Apple Podcasts, or any of your favorite listening platforms.
Hi, I'm David Plotz, the CEO of CityCast. The best way to learn a language is immersion, living where the language is spoken and using it every day. That's how I learned French as a kid. But if that's not in the cards for you this year, you can still learn a language the second best way, and that's with Babbel. I live in a city with a huge immigrant population. You probably do too. And in my hometown, a lot of my new neighbors speak Spanish as a first language, and we have lots of great Mexican and Central American and South American restaurants and stores. I wanted to be able to communicate just a little bit better with some of my neighbors. So I started with Babbel, the science-backed language learning app that actually works. And after just a few extremely enjoyable weeks learning Spanish with Babbel, I've already gotten comfortable ordering at a restaurant and eavesdropping on my girlfriend's conversations with her mom. Look, learning a language isn't always easy, but with Babbel it is fun and it feels useful, basically immediately. That's why Babbel has over 16 million subscriptions sold. Plus, all of Babbel's 14 award-winning language courses are backed by their 20-day money-back guarantee. Here's a special limited-time deal for CityCast listeners. Right now, get up to 60% off your Babbel subscription, but only for our listeners at babbel.com/citycast. Get up to 60% off at babbel.com/citycast. Spelled BABBEL.com/citycast. Rules and restrictions may apply.
Every day, data brokers collect and sell your personal information to third parties, like your address, phone number, health and financial records, even your social security number. Then this information is used against you by scammers and spammers. And it doesn't end at annoying robocalls or junk emails. Your identity could be stolen. But an excellent way to stay safe out there is by checking out Incogni. That's INCOGNI. It only takes about 3 minutes to set up, and then it gets to work scrubbing all your personal information from the web. They tackle over 180 data brokers and people search sites, update you with progress reports, and offer a 30-day money-back guarantee. So protect your data, your time, and sanity with Incogni. And right now, CityCast Portland listeners can use the code CityCast for 55% off the annual plan at Incogni.com. That's INCOGNI.com. Today, I'm looking at another troubling story from two of the biggest Portland area hospital systems, Providence Health Services and Legacy Health. This one is coming from Willamette Week's Lucas Manfield. He's reporting issues arising in Providence after they sold their testing laboratories to a multinational North Carolina corporation named LabCorp. I didn't know that hospitals could just sell off pieces of themselves. Mm-hmm. So I guess like the people who work there stay there, but they're just being managed by another entity is what it seems that is what's happening. But patients and Providence health providers are raising alarms at the service they're getting. For one, patients are reporting lab waits are going from 15 minutes before the sell-off to now between an hour and a half. But even more alarming, doctors are complaining that lab results are coming either back riddled with errors or severely delayed.
Oh, gosh.
And just to add some stakes on why delayed results at a hospital can be life-threatening, it's estimated that 70% of healthcare decisions rely on the results of laboratory testing. And that's just like your basic blood, stool, tissue, sample lab work, which isn't like, of course, like you were like, yeah, well, duh. You know, no one's going to just like put their hands on you and imagine what you have. But it is like, it's pretty much almost everything, you know?
Yeah.
And Lucas gave an example of the lab result delay that could have cost a patient his life. Last month, a 70-year-old man experiencing shortness of breath went to a Providence urgent care clinic in Hillsborough. He had history of heart failure, so the attending Providence doctor ordered a blood test that would basically just clearly detect if he was experiencing a heart attack. And a test, the doctor noted that should have taken 90 minutes max. But they didn't get results back for 7 hours. And by then, the clinic had already closed. The patient was sent home. And then the doctor, once he got results, had to call the patient back and just tell him to go straight to the emergency room because, yeah, he was indeed having a heart attack.
That is ridiculous.
Okay, I do want to pause something here and be like, yeah, LabCorp, get your shit together. But at the same time, I'm just like, if I were the doctor and there was a person who was just like, he might be having a heart attack, we're not getting results. It's been more than a couple of hours. I would have just been like, go to the emergency room.
Yeah.
Just go. Who knows? Like, you know what I mean? Like, why would you be like, I'm sorry, we've got to wait. But I don't know. Like, it's like we have the shittiest medical health care system. Maybe they're just like, oh, if we don't do these tests, then, you know, your insurance won't pay. You know what I'm saying?
Anything, right? Like, it also comes down to the patient with how much they're willing to take a chance on if it's worth it to go. You know, that stress really makes that decision hard in that moment. And even like you were mentioning all of these delays, knowing that you'll have to show up and wait over an hour to do a blood test is also discouraging people from even showing up in the first place, which is not a type of medical system you want to have off the bat, because people will choose not to go because they have to go to work instead or pick up their kids. So many reasons why it shouldn't be that way.
Totally. There's another anecdote that came from a veteran inpatient cardiology nurse at Providence St. Vincent saying that it now takes a week to run tests that once took a day in her department.
Oh my gosh.
And she's concerned that LabCorp isn't being held accountable. I do want to point out, though, that both Providence and Legacy sold their lab testing to LabCorp like at roughly over $100 million each, because they were both experiencing a ton of money woes. But Providence seems to be the only one having these delays and quality issues. Legacy is claiming they're not having the same issues as Providence, which is interesting to me. Because again, it's not like they got brand new labs. Do you see what I'm saying?
Yeah.
So Legacy sold their labs off to LabCorp before the OHSU merger agreement. I don't know how getting absorbed by OHSU is going to affect the in-house lab, if at all. LabCorp's Legacy staff has also unionized, and Lucas reported that burnout and short staffing seem to be their chief complaints. Not delays or quality issues, because he of course went to like Legacy and was like, hey, Providence is like saying all this stuff, how are you? And they're like, we're fine. we're good. I mean, we hate it here, but we're good.
At least we have that.
Yeah. But I was also poking around at Reddit and local healthcare threads, just because whenever we have a story, I'm just like, what are the people saying? And it appears that lab workers at in-house Providence labs who are now under LabCorp are saying that when the buyout happened, they wiped out their PTO.
Wow.
Their wages were drastically reduced. And to add insult to injury, they had to switch over to a new health plan, and with even higher copays and worse coverage. And if we needed more evidence that the U.S. health system is broken, even those who are part of the healthcare system can't seem to get decent care. Just so effed up.
Yeah. Nobody has options for anything reasonable when it comes to healthcare at this point. And I think one thing that's also interesting about this headline, Claudia, is how wonky the rules of regulation are at a state level of who can sell to who at what point. And with this deal specifically, there was such vague language going into why it was okay and why it wasn't looked into any closer, this deal between LabCorp and Providence. And it said, quote, the deal didn't cover substantially all of the healthcare entity's assets and operations, and it was therefore not subject to review, which a spokesperson from the Oregon Health Authority told Willamette Week for this story, which is just you wonder what the rules really are and how much it is case by case and how many things just kind of slip through the cracks because of that.
Yeah, let me just give some context to what Giulia just said. Before Providence and LabCorp made their exchange, they actually forwarded the notice of their deal to the state, and regulators refused to even look at it. And the reason they did that is because back in 2021, Oregon passed a law requiring regulator review of major healthcare deals to ensure that these types of consolidation don't come at the cost of the patient care. But they're more thinking the big mergers like OHSU and Legacy have agreed upon. They're going to look at every step of that, But when they're thinking of just LabCorp, which our producer right now just wrote us and is like, hey, that sounds like a fake evil company, which is true. LabCorp does sound like a fake evil company.
It really does.
They're just yeah, that's just the lab part. Good luck, patients and everybody else. And it's no, it's clear that there should be more regulation here. Someone should be looking. Yeah. But the fact that they could have possibly lost their PTO wiped out and then got an immediate wage decrease, that just sounds awful, because everybody knows the patient care, it's that is trickle down. You know what I mean? If the people taking care of you are not being taken care of, even if they're trying their darndest, it's they're humans. They have to deal with all the stuff on their shoulders,
It's funny that you mentioned that, because although Legacy and Providence may be struggling financially, LabCorp themselves isn't. Their numbers came out and it's looking like they're actually doing okay. All the while, like you just said, their workers are struggling and they have issues with staffing being short and people aren't being taken care of. So yeah, pretty frustrating circumstance.
Yeah, capitalism.
Yeah.
Well, that was depressing. I'm sorry, you guys, if you're either at Providence or Legacy. Legacy seems to be doing a little bit better. But I do want to say, just real quick before we move on, how annoying it is when your main lab is sold off to a different entity, because your we have Aetna, and Aetna's like, hey, you are definitely covered for Providence and their lab, but if they sold their lab to a different entity, it could not be covered by your health care plan. So then you're screwed and you have to go somewhere else.
So then you're running around town just to get your
I'm
procedures
running
done.
around town. Yeah, I have to go to Quest or some bullshit. It's so freaking annoying. That's all right.
I hear you.
That's why when I'm like, I have to take a lunch, I'm like, and it's going to be a long lunch. I'm literally chasing my healthcare.
God. See, this is the problem.
I know. I'm just like, somebody, please. All right. Well, it's been a little bit since we've done these midweeks, and I miss them mainly because we have mailbags that we have a lot of cool messages that we get from our listeners, from our members, and we don't have any place to say them. And I really like sharing them because sometimes the threads that happen with listeners with their own messages, do you know what I'm talking about? We'll read something that somebody would be like, actually, those are my favorite.
Just like the gathering place.
I know. Well, can I read you one that I thought was really interesting?
Yeah.
Okay. This is by a listener named Lalo. He wrote, "Hi, Claudia and John. I listened to the District 1 and 2 episodes back to back yesterday, and I appreciated your coverage. One of the questions that came up that got me thinking was why District 1 has so fewer candidates than District 2. And if you don't remember, District 1 is deep outer southeast, and deep outer northeast. And District 2 is my district, and I think your district as well, right? Which is north and northeast Portland.
I'm District 3.
Ew. Ow.
Sorry.
Sorry.
District 3.
All right. So anyhow, District 2 had an insane amount of candidates running. District 1 had a handful. And we were just like, what's up with that? So Lalo is one possibility is that this reflects the gentrification patterns that you touched on. Wealth provides the privilege of time for dedicated community involvement. My spouse and I both work full-time with 2 kids, and we can barely even make it to a Russell Neighborhood Association meeting. That's a neighborhood right next to Park Rose. Also, just a minor thing to mention, and this is the reason I'm reading it too. As another Bay Area transplant, which by the way, Lalo, you shouldn't say out loud, I cringed when I heard y'all pronounce Marin. The emphasis is on the I, not a big deal. It's just a regional pronunciation like we have to learn in Oregon, Cooch, Willamette, etc. Love the episodes, feeling better acquainted with the candidates in my district. I want to say that we said Marin. And he's just like, it's Marin. And what was even more embarrassing is that I knew this. I'm from California, but I'm not only that, I listened to the Dead Kennedys. Dead Kennedys have this song called Moon Over Marin that I love. And it's not Moon Over Marin. It's Moon Over Marin. And I just was like, yeah, Marin, whatever. But we are getting a lot of these messages thank you so much for going through some of the candidates of our district, because it is a lot of people to go through. It's going to be, 12 new council members, 3 per district. It's a lot of people to figure out who you're going to vote for. It's our pleasure. It's one of the reasons why we have this podcast. And if you want to better support us, we have a membership and you are more than welcome.
Yeah. If you are interested in supporting us, thanks for mentioning, Claudia. You should go to our website, portland.citycast.fm. There's a massive banner at the top of this site that says membership. Just go ahead and click on there. And there's options for you if you're interested in supporting us some more and all the work that we're doing. We have more district previews coming up and other things we're working on. So if you want to support us, please go to that site. But I do have another piece of mail I can read out right now, Claudia, if you're ready.
Let's go.
All right. So this one is from listener Luke. And they said, "Hi, CityCast Portland. Your July 12th episode, Long Hot Waits for the Max, a Lloyd Center music venue, and a massive grocery merger, hit on something I'm passionate about, the Kroger merger. The opinion of the episode's guests came across as mixed on whether the merger was a net good or bad. I'd urge you to rethink these views. This merger would be terrible for the employees who work at these companies and the customers who shop at their stores." He then went on to list a ton of brands that are owned by Kroger and Albertsons, and then said, "There is already incredible consolidation in the grocery store market. Capitalism needs competition to put pressure on rising prices. when lawyers shop around a merger, they will promise anything to allow it to go through, i.e. prices will not go up, no one will be fired, etc. Historically, these promises are not kept and are not enforceable after the merger goes through. We will need a well-informed public to help combat further corporate mergers. And also on the same episode, a different listener reached out to tell us that during our executive producer John's segment on the merger, he referred to United States District Judge Adrian Nelson as he, him, and Judge Nelson's pronouns are actually she, her. So a quick correction on us as well. But yeah, a lot to say on that piece of mail.
Yeah. And thank you to the people who reached out. Thank you to everyone who always reaches out and corrects us. It's actually very, very helpful. Anyhow, well, thank you so much, everybody, for writing to us. Well, we have a lot more. We just can't get through it all. Hopefully, not this week, but the following week, we'll have some more mailbag to share. Just a reminder that you rating and subscribing to the podcast really does make a difference. I know there's a lot of you who listen. Thank you. If you have, just take the time just to hit, the little button that gives us the stars. I don't know why, but it really does bring other people to the podcast. Something with the algorithm. I don't know. Well, everybody, thank you so much for hanging out with us this Wednesday. Julia, thank you. What do you think? This was our first midweek together. What do you think?
We've done it before, Claudia. How dare you forget?
A midweek. We've never done a midweek together. I will send you a link. I'm just saying on Wednesday. This is our first Wednesday midweek. Yeah.
How dare you forget our time together? I am so upset.
I meant this is our first Wednesday midweek together. It'd be so funny. I'm like, well, Julie, this is your first time on the show. How did it go?
How's your first day producing? No, my mistake. I'm not sure how I feel about Wednesdays. I'm warming up to them. To be continued, I guess.
Yeah. I love them. I'm being very honest. Awesome. Well, thank you everyone for listening. Have a great rest of your day. Well, that's all for today here on CityCast Portland. Thanks so much for listening. We'll be back tomorrow morning with more from around the city. Until then, see you at Slim's.